My name is James Newton, and I'm representing a team of biomedical engineers that includes Ali Eisenbeis, Melissa Branson, and Jesse Lamb. Our mentoring clinician is Dr. Ronald Day. Our product is the pediatric OxyJamas, an oxygen delivery mechanism designed to revolutionize nightly oxygen therapy for pediatric patients. Tens of thousands of pediatric patients each year are diagnosed with conditions such as pulmonary hypertension that require nightly oxygen therapy. However, these patients struggle to comply with the prescribed treatments due to discomfort, resulting in poor treatment of their conditions. One doctor who has worked with hundreds of these pulmonary hypertension patients reports issues of non-compliance in virtually 100% of mentally disabled children, 75% of non-disabled children, and even 50% of infants. We've created a novel mechanism to deliver oxygen in a way that maximizes comfort, increasing compliance, and betters treatment for these pediatric populations. Our oxygen delivery mechanism is incorporated into the hood of a hooded pajama and directs oxygen flow from the perimeter of the hood towards the nose and mouth, creating an increased concentration of inhaled oxygen. The respiratory market currently is worth roughly $9 billion per year, and is growing at a rate of 8.8% per year. In the United States alone, roughly 800,000 pediatric hospital stays require supplemental oxygen, while 163,000 are diagnosed with pulmonary hypertension requiring further treatment, further oxygen therapy at home. The standard of care currently is the nasal cannula or face mask, neither of which produces sufficient compliance for adequate treatment of these conditions. Other comparable intellectual property has yet to acquire any significant share of the market. Our device is unique in that it is more comfortable, more portable, and socially preferable, while being less restrictive, intimidating, and/or isolating. Preliminary validation has produced comments such as, "This would be huge for the market. The nasal cannula tends to be the bane of every child's existence, and I would buy an alternative." We have completed preliminary verification testing of our first prototype and exceeded acceptance criteria in every regard. We continue to look towards clinical testing and manufacturing of our final product. I'm James Newton from Team 653. Thank